How you doing, love?
All right.
Same as you.
Hey, we're gonna mute you if you're not on mute. There we go.
All right. Hi, guys. I'm Emma Valinsky. I'm the manager of policy and programs for the Executives for Health Innovation. I think I know a lot of you on this call, actually, but if you don't, I wanted to reintroduce myself. I'm very excited for today's policy briefing because this is something I have been incredibly interested in, and somehow EHI threw me into this world. And so I've been talking to a lot of people recently, and I think that our speakers today will touch on all of the basics, but also I think that we'll get into some really interesting, I'm gonna ask some really great questions, I'm sure. So, but just to quickly introduce our speakers, we've got Greg Garcia here. He is the Executive Director for the Healthcare and Public Health Sector Coordinating Council. And a lot of us know it by HSCC. We have Andrew Tomlinson, the Director for Federal Affairs at the College of Healthcare Information Management Executives, or CHIME. I keep having to read them because I don't know the actual ones. And then we have Greg Garneau. He is the Chief Information Security Officer at Marshfield Clinic Health System. Before I get started, I wanted to reiterate what Catherine already said. If you have any questions that you want to ask the speakers, feel free to put those in the chat box. I'm going to do a few moderated questions, but after that, we'd love to hear from you guys. You can either put them in the chat and I'll read it, or you can unmute when we get there and ask yourself. So I'm going to start this briefing with the basic question that actually is just the title of this briefing. I was hoping you guys could talk about what you think is the greatest cybersecurity challenge in the healthcare industry that we're going to see in 2022. And then maybe on that, just as we are on our policy briefing, just the policy solutions that you see either developing or already in place. So I was going to go with Greg Garneau. You are the one that's in the center for me, if you want to go first.
Oh, I'm the center square today. All right.
Yeah, you're welcome.
Awesome. Well, thank you so much. It's a pleasure to be with y'all today calling in from very cold central Wisconsin, but I'm happy to be here. So I think in the last couple of years, we have seen the increase in ransomware attacks on the health system at health systems at an unprecedented pace and volume. I don't see any reason why 2022 will be any different for us. I know from our perspective and from our lens, we're spending a significant amount of effort, energy, and resources to ensure that our cyber resiliency programs, business continuity programs are all of those processes are being validated, in place, being refined for when an event like this will occur. I think one of the things that was very impactful to us, I know from a health system perspective, was also third-party risk, right? The Kronos ransomware incident from the middle of December had a very profound impact on us. It also, I think, highlighted the need to ensure that business continuity plans are in place for our third-party vendors. But from my lens, I think continuing to ensure that you're mitigating your risk, right? You're assessing your risk, you're putting programs in place, the talk about the phishing, right? So from our perspective is still, the weakest link in the chain is oftentimes your employees. So implementing a end user security awareness program where we teach folks through CVTs and then also test through phishing campaigns. Those are all part of practices that we use to mitigate the risk and ultimately, save patients because it is a patient safety issue, especially when you look at medical device security, which is also front of mind for us.
Awesome. Yeah, as Catherine was saying, we were just reading that report about how I think it's ECRI was saying that patient safety was one of the anyway, we heard it was very important, patient safety, and that's EHI loves that stuff. So I appreciate you saying that. Andrew?
Yeah, I think Greg touched on some of it, or Greg Garneau touched on some of it. I know Greg Garcia will touch on more of it later, but I think in terms of the biggest challenge, Greg talked about the increase in the seriousness and the amount of attacks, and then discussing something like a Kronos, which is an exterior attack, which is just highlighting so many of the issues across the whole space that no one is really safe as we exist right now. Everybody is threatened as we move forward. And I think the biggest challenge that we see in our membership is raising that floor for everybody to make sure that everyone's playing on the same field in terms of defense, as it relates to making sure that there is an ability within small providers to be able to react and defend against these sort of cyber attacks. I think many forget that larger systems, and I know both Gregs know this firsthand, larger systems are more equipped, have several staff dedicated to both technology and information security. But a small provider, maybe you're talking about a one physician office, there's probably one person, there's a chance that's the physician themselves, that's both their CTO, CIO, CISO, and they're trying to be able to react to what is happening in real time while also trying to care for patients. And you start to run up against issues of, you talk about an electronic health record being down for a ransomware attack. That is certainly going to impact patient care, but you're also talking about the ability and time for a smaller provider to be able to even dedicate to a cybersecurity incident. They're going to prioritize seeing their patients opposed to being able to maybe read every alert that comes out. So in addition to the amount, it is going to be about having the ability to respond. And similar to the Kronos, issues that we saw, we have the Log4j problem that we saw last year, in which many providers are now not only having outside services impacted, but they're having internal, whether they're medical devices or even a device that's not even, maybe it's their waiting room television that is impacted and having a vulnerability. They're now required to wait for a vendor to respond to be able for them to be able to secure their system itself. So in terms of what Chime is seeing from our membership for our biggest security issue, it is definitely about making sure that the smallers are not left behind, whereas the largers are still, themselves already struggling for this. So it is about raising that floor so that way we can all be secure, or at least have a baseline to be able to be secure together. So that's I think what we're seeing for this year.
And is there any specific policy that or federal policies that you guys are looking at or promoting?
Yeah, I think what we're anxiously waiting for is one of these policies that are going to be able to help at least give some guidelines for providers is the Public Law 116321, which was formerly known as HR 7898, which allows for the Office for Civil Rights within HHS to give some leniency in terms of breach notification penalties for a provider. So it would allow them, if they're following a designated framework and then report the breach appropriately to HHS, would have the ability to have potentially some penalty leniency within that. We're not sure how that's going to be implemented at this point. I know many of us in the provider community are watching that because it'll give the framework that we can then say is a government-backed framework that everybody should be basing on, or a set of best practices. And it incentivizes providers to be able to notify when there are those breaches. The biggest issue that we still see is communication. And it's important for us to all be communicating as a piece of critical infrastructure together, because the more information we can share and the faster that we can share it, the easier it is to protect other providers that could potentially be exposed. We have heard a scenario in which a hospital across the street had no idea that the one that they would look at every day through their windows was currently down from a ransomware. And that is scary, because that ransomware could be coming to the hospital and they may have absolutely no idea that it's even in the wild. So increasing communication is going to be huge. And we're hoping that public law can do that.
Awesome. Thanks. And Greg Garcia, I figure you're able to go off of that. What do you answer?
Yeah. Okay. Ready to rock. I thought maybe it'd just be helpful just do a quick background on what the Sector Coordinating Council is, so give you a little bit of context for where we're coming from. So the Health Sector Coordinating Council is We are one of 16 critical infrastructure industry sector councils called out in a series of presidential executive orders. So we are, in effect, we are an advisory committee to the government on critical infrastructure protection. We are critical infrastructure, just like financial services, electricity, telecommunications, water, transportation. And we are industry self-organized to identify and try to mitigate collectively those systemic threats to our ability to deliver critical assets and services to the public, whether they're natural threats or man-made threats like cyber attacks. So the Cybersecurity Working Group of the Health Sector Council is now about 320 organizations, mostly from industry, a couple of government organizations across the spectrum of healthcare. So the health providers, the medical device companies, pharmaceuticals, health IT, plans and payers, public health. And we're trying to coalesce around those cross-cutting cybersecurity issues that affect all of us in similar ways. And so, in that sense, we have a public-private partnership with the government, non-regulatory, non-competitive, just trying to raise the bar of security and resiliency across the sector. And so, the question is, what is the biggest challenge in 2022? I can tell you, I was many moons ago, I was the Assistant Secretary for Cybersecurity and Communications at the Department of Homeland Security, the precursor to the CISA agency. And I was asked that question regularly. What are the biggest challenges facing any industry in the United States? And my answer today is the same as it was then, and that is the biggest challenge is complacency. The people on this call right now, Greg and Andrew, they're not complacent. They understand the risks of cybersecurity, and many of the individuals that they work with day to day understand that. But as a whole, and not just the health sector, but any critical industry sector as a whole, there remains a level of complacency in terms of investment and awareness and senior executive attention to enterprise risk and the risk that a single enterprise can introduce to a broader sector in an interdependency, interconnected way. It's all improving. Don't get me wrong. It is improving, but yes, complacency it's often manifested in hope as a strategy. I hope I don't get hacked. Let's commit that extra $1 million we have in a new MRI machine instead of a modernized cybersecurity risk management program and appropriate staff to deal with that. These are hard questions, that particularly health providers need to make day to day. And the pandemic only exacerbated that sort of existential resource decision making. So first off, I think that, and what both Greg and Andrew outlined in terms of some of the big threats are absolutely right. I think maybe what is unique, and Kara rightly said she understands the healthcare industry to be somewhat unique in this respect. And that is, we have to look at cybersecurity through the prism of patient safety and life or death. And that in the Cybersecurity Working Group of the Sector Council, that is our motto. Patient safety requires cyber safety. Because if we look at the potential for medical devices that are connected to a human being, or monitoring a human being, or administering doses of something through automated means, and if that gets hacked, corrupted, the data, the operational functionality, that poses a clear risk, a clear and present danger to the safety of a patient. Likewise, where ransomware can shut down operations, IT, operational technology, operations within a hospital, that can lead to the diversion of ambulances on the way to the hospital, people being redirected to other hospitals, delay of care, inaccurate data, health data, on allergies or medications or blood type. All of these things introduce serious patient safety concerns. And so that is, no matter what the particular type of attack, if it is disruptive or corruptive, we have to be concerned about it. And it's ever changing and ever evolving. On the policy level, Andrew named one in particular, and that is how do we drive more incentives into the space? Positive incentives for investment in cybersecurity through awareness in cybersecurity. It isn't enough to punish the victim. The PL 116-321 that Andrew cited is a very good first step. There have been some conversations about whether the reimbursement system can incentivize. That is not, the reimbursement system doesn't require cybersecurity, but if you do better cybersecurity, if you can attest to implementing certain consensus-based, widely recognized cybersecurity practices, frameworks, controls, if you can show that, maybe CMS can give you better reimbursement rates. If you can't show that, you're going to be, you're going to continue with the current rates. This is a kind of a proposal that the smaller hospitals certainly are going to chafe at, because it just simply adds to the burden, compliance burden that is already difficult for them to comply with. But that's what we tend to be looking for in the sector council, is how do we drive more incentives into the sector and drive more awareness. And for those who are in particular need, the small community hospitals, rural hospitals, how can we bring them up to a minimum baseline of security and awareness that some of the larger organizations enjoy? And maybe there are grant programs available, grant programs that will enable you to invest in technology or to join industry groups that are formed specifically for cybersecurity awareness and incident response. That situational awareness often is one of the best tools in your toolbox, because a common saying I use is none of us individually is as smart as all of us collectively. So to the extent that we can incentivize or support a community approach to cybersecurity through awareness and joint incident response, I think we'll be better off.
Thank you for that answer. Also, I guess when I was originally thinking this question in my brain, I'd been recently doing a lot of ransomware work, and I think of things like big bad guys, what's the big bad guy coming for us? And it's just do something, remember to look up. And so I hadn't even thought about that. So thank you. Looking at the time, I want to move into our individual questions. Andrew, I'm going to pick you to go first. Congrats. Would you give us an idea of where Chime fits into the healthcare cybersecurity world, and specifically why it's important for your members to be working together?
Yeah, sure. I'd love to touch on that. So Chime itself is made up of chief information officers, chief technology officers, and then there are chief information security officers that are involved in there as well. And then Chime has a sister association, the Association for Executives in Healthcare Information Security, or AHIS, and we work together and many of the AHIS members are Chime members as well, and vice versa. So it's important to remember that some of the same organizations, we're working within them, but we want to make sure that we're able to work with as many pieces of that security executive team. And the importance of what Chime is able to bring is elevating at the policy level what we hear from our members directly. And so we get a two-way sort of feed of information. We can feed it back up to the government to comment on regulation, or my colleague Cassie Leonard, who does our Congressional affairs piece, going back to Congress to highlight what our members are seeing on the ground. how easy is it to get in touch with the government? How easy are some of these requirements? I think we've had a lot of discussions internally about the legislation that was discussed earlier in this call about the 72-hour reporting period and what is the right size, what works, what doesn't, and how can we provide that feedback. And then on the other side, we have the ability to feed down out of that downspout to help our members understand what exactly is coming out of the federal government. I think a great example is, while many don't think of it necessarily as a security piece, but I often do, because I view privacy and security going somewhat hand in hand, was the Federal Trade Commission's recategorization of what a personal health record is or what their health breach notification requirements have on there, and including the third-party application piece of that. And many of our members were concerned about how is health data going to be secure moving amongst someone's mobile phone applications and things like that. And it's important for us to bring that sort of a policy clarification down to our members to highlight how they can talk to their patients, how they have to prepare, because privacy goes hand in hand with security. If your information is not secure, then privacy won't be protected. And so that's where Chime fits. It's trying to sit in between the provider, policymaker space to make sure that we can have the best regulation and the best laws that are put in place to keep patients and providers secure and safe, while also making sure that anything that is in place, imparted on the healthcare community, that they're able to understand it and then pivot and react as best as possible. Greg highlighted what is the ongoing struggle we know in every member's organization is, do we dedicate information to security or do we dedicate information to care? And the big question that we're able to try to help answer is, if we dedicated it to care, how can we fill the gap in what we need? So it's important for Chime for us to be able to highlight security risks, ongoing theaters of what's happening, whether it is a ransomware or it is a new security flaw, and help those organizations that may not be able to help themselves to be able to have that security focus. So I think that kind of encapsulates where Chime is in that space.
Awesome. Thank you so much for that. I want to pivot just a little bit. I want to talk to Greg Garneau. I was hoping you could give us the insight from Marshfield Clinic, specifically what your hospitals are seeing, and maybe a little bit about the programs that you're putting in place or would like to put in place that could help with these challenges.
Sure. So I think Greg brought up a couple of really good points earlier about the rural critical access hospitals and the smaller health systems that were alluded to earlier, not having the staffing or funding to adequately secure their environment. So the Marshfield Clinic Health System is actually one of the nation's largest rural health systems. And we've been going through a rather large merger and acquisition phase over the last few years of purchasing some of these small critical access hospitals. And what I can tell you from our experience is, while the staff do their very best, they're very limited in terms of people and funding to adequately secure a healthcare environment, a hospital, or even clinics. So thankfully, we have a leadership team that understands the risks, understands what we're facing, and has been very helpful when it comes to funding for the programs that we need. So not just the programs, but also the staff. And staffing is a huge issue for health systems across the country, not just ours, but even the largest systems in the country, there's a shortage of talented cybersecurity professionals. So while COVID helped us in the sense that we can hire remote workers, they don't have to be living in any of our service areas necessarily. We still have issues with staffing, and that if you don't have the staff, you can't run your programs appropriately. And as was alluded to with the Log4j issue that came up at the same time as the Kronos issue did this past December, your staff is stretched super thin trying to remediate and mitigate risk, but then also trying to run operational programs. So we have spent a lot of time, as I mentioned, talking about, how do we build out our ransomware resiliency program? But we've also introduced a number of different solutions that will help us mitigate some of the risk, especially as it relates to medical device security. there are solutions that we've implemented that help us, get vision into the vulnerabilities that we didn't have previously. But one of the things that is also important, both my colleagues mentioned that, it's collaboration between organizations. When I first got into healthcare cyber, the idea of me talking to CISOs or colleagues across the country, it really didn't exist necessarily, or small groups of folks. But joining Greg's group, that was one of the great force multipliers for my health system, right? I was able to then collaborate with colleagues as well as device manufacturers and others in ways to better, manage our cybersecurity postures health system. The 405D work from HHS, we talk about very, very prescriptive tools that people can use in healthcare cybersecurity to help secure their environments, to secure their enterprise, right? Top 10 risks, 5 things you can do to, secure your environment. So being able to collaborate with colleagues from across the country, right? We've talked about this one team, one fight kind of idea. This is something that we all take very seriously. So there are still significant challenges though, from staffing and funding, and you can buy a ton of bright, shiny boxes that you want to implement into your system, but if you don't have the staff or the time to do it, they're just sitting in a corner being unused. So we've done our very best over the last number of years to ensure that we bring in solutions that can really make a difference quickly for our organization.
Awesome. Awesome. Thank you so much. I normally would be moving into the audience Q&A. So this is your hint, everybody. Start getting those questions going. We're very excited to hear from you guys. But I was just going to ask Greg Garcia, but now I kind of want to open it up and ask everyone now that I've listened to you guys and ask, what have you been seeing in the federal policy world that seems like a good idea, or people find it's a pretty popular idea, but you think your members know it's burdensome? What is, I guess, the misunderstanding that people are seeing?
I'll give you one example, and just to back up very, very quickly. First, I appreciated Greg's recognizing some of the best practices that we're producing for all of you, but both EHI and Chime and Marshfield are members of the Sector Coordinating Council. If you go to our website, healthsectorcouncil.org, you can look at, under the recommendations, all of the best practices that we've published so far. And these are done by the members. It's the experts. It is the stakeholders who have the expertise and the experience in cybersecurity to help guide a lot of those smaller organizations that need a place to start. So I just wanted to put that flag out there for you. Things that seem like a good idea. So one thing that industry depends upon the government for, in many cases, is good intelligence. Not classified intelligence, but intelligence about foreign actors, malicious actors in cybersecurity. What are their methods? What are their tactics, procedures? And how do they convey that information to us in a way that is actionable? I mean, this is specific and actionable, and this is really a cornerstone of what it means to collaborate between industry and government. That we both see the same thing, or we see different versions of the same thing, and we need to sync up and share what we're seeing in terms of threats or incidents, and get the ground truth, and then have the right guidance on how to act on that. This has been a work in progress for at least the 20 years that I've been involved in this public-private partnership, and it remains difficult. So, as an example, the current tensions in Ukraine. You tend to get these urgent conference calls hosted by the government, whether DHS or whether HHS, And what they tell you is, watch out, something could happen. We can't tell you what, and we're not sure how good, how specific the information is. And it's a big waste of everybody's time. So somehow we need to crack that nut on how government, when it is in possession of something that is credible and potentially actionable, that they can give the industry something specific enough for us to take action on, rather than doing these fire drills that don't really give us much guidance. So I think that is one example. Stop classifying so much. Change from, need to know to need to share culture, that kind of thing. So that's one idea. I'll toss it over to the other panelists.
Yeah, I think if it's all right, I can comment exactly on what Greg's talking about. We went through one of these yesterday. That CISA has told everybody to be on alert for what's happening with detentions. And we're stuck in the middle of wondering, is this something we need to alert membership to? Is this something that membership already knows? Or are these things that membership should already be doing, so there's no need to notify them? And it's a battle. And I don't envy some of the government's battle of knowing you would rather over communicate generalities than have something happen and under communicate it. But we absolutely need more specific, actionable things to do, because when there are massive vulnerabilities, we get questions of, well, what can I do about it? And in healthcare, an answer of, you got to turn it all off is not going to work. You can't turn off your electronic record while you're working. And I think, to me, the big piece of federal policy that needs to change is healthcare needs to be at the table. We've seen a majority of executive orders creating different groups to discuss cybersecurity. We saw it, I think, in reaction to the pipeline hack last year. And when I go and review these on behalf of Chime, often healthcare is not listed as one of the primary seats on these committees. And the question is always why? And the answer we always get is, if you're needed, you'll be called. But healthcare is a member of critical infrastructure, and it is just important as it is energy or telecom or transportation. And I think that's, to me, one of the biggest frustrations I have right now, is that healthcare is often the most vulnerable and the most often attacked, but then is not often allowed to be at the table when they're discussing how to move forward, how best to strengthen policy moving forward. And I think it's critical for both the executive branch and the legislative branch to remember that healthcare is important to be included and is not something different than an electrical grid. It's just a slightly different process of how they process some of this information, opposed to being something that should be excluded or dealt with differently. So I hope healthcare is brought onto many of those roundtables. So I think that's where I stand. Greg, Garneau, I don't know what your thoughts are.
Yeah, I actually just wanted to ask Greg if it's okay, maybe, and others feel free to ask your questions live too, like I am. But Greg, Garneau, I was wondering from your perspective, to kind of put a fine point on this, what Greg and Andrew have said to maybe wrap up this hour, is what are the real, we've kind of alluded to these, like, what are the risks? Like, we've talked about some, like, we alluded to patient safety risks, national security risks. Like, why is healthcare considered a critical infrastructure? What are the very real patient safety risks that you're trying to prevent on the ground? And maybe, what's the value? Like, why is healthcare targeted so much?
Oh, geez, we need another hour, and I'm sure Greg has a lot more answers for you, but I'll take a stab at it. I would like to just follow up on Andrew's point. Carol, we really appreciate you being here today. One thing it's important to note, the healthcare folks, we are the biggest target for the bad guys. They love the stuff that we've got, and they've been making a ton of money off of these systems and others. So definitely reach out to folks, in your own state. There's some really good CISOs there who would probably be more than happy to help. So, we talk about patient safety, ransomware, any of these cyber events, it's patient safety issues, right? So we can go back to 2020 when all of the major health systems that had impacts, when you're shutting down 400 locations, you're diverting patients, right? When CHS got hit, you're down to paper and pen, your downtime procedures, right? It's clearly going to impact patient care. And when you talk about interconnected medical devices and the ability for threat actors to take advantage of vulnerabilities within them and then own an infusion pump, right? And get on the network and do some things with it. You know, these are the kinds of very real concerns that 5 years ago, I certainly wasn't thinking about when I was in cyber. I was thinking about other things, right? But this has now become front of mind for us. You know, the Marshfield Clinic Health System has a world-renowned research institute. And the data that we have is insanely valuable to lots of different folks. So again, there's another area where we have to defend against, you know, folks coming and grabbing some of that data. But ultimately, yeah, like I said, we could do this for an hour. So, but ultimately, the work that we have to do is protecting the health system and protecting the patients. And there are, unfortunately, a number of ways for people to get into environments that could cause disruption and cause harm. And, you know, we have, you know, dedicated teams and groups and partnerships like the folks we have on the phone that will help us with that. The federal government, I think, also can play a much larger role in assisting organizations in securing their environments, incentivizing them. The grant funds for smaller organizations, I think, would also be helpful.
Awesome.
But I'll let Greg. That's a perfect question for Mr. Garcia that you asked me. So I'm hopefully I did a reasonably good job at answering it. So.
Perfect. As we are coming up on the end of the hour, I just want to quickly ask the audience. I'm sure you guys are dying to ask questions. Feel free to type them in, go off mute. I'll give you 3 seconds to quickly go for it, and then I'll ask everybody to wrap up. And you know, I always like to ask this question is like, if everybody only walked away from this meeting with one single thought, the one thing they took away from all of it, what is that thing that you think they should definitely take with them back to their work? So
I can go first, really off the bat. I think to me, it's not, I think Greg and I have all said great things, but I think the number one thing I'm going to take from this is what Kara said earlier, and that there's a huge reporting bill that is moving through Congress related to mandatory reporting. It's going to impact healthcare, and they haven't heard from anybody. And so it's important for healthcare to make sure that their voice is heard in both federal policy and on the legislative side. And if they don't hear from us, if the lawmakers and policymakers don't hear from us, then we can't be represented. They have to let us at the table in certain parts, but sometimes the burden is going to be on us to make sure that we as healthcare are advocating for ourselves. So to me, that's what I'm taking away. I think that is one of the key takeaways, is that we need to make sure that we're making our voice heard.
Awesome.
Oh, Greg Garcia, you're muted.
Sorry, there's a good set of principles that all the organizations on the call can look to in terms of evaluating the bill. There's the National Council of ISACs. ISAC is Information Sharing and Analysis Center. They are the technical operational counterpart to a sector coordinating council. They do the watch, warning, and incident response. There's a council of all of the ISACs from all of the critical industry sectors, and they put together I can put a link in the chat. They put together a set of principles for what mandatory reporting should look like, because most organizations do support that we should have some kind of reporting so that we have better fidelity into the nature of attacks and threats. And then be able to improve our preparedness on that, improve our incident response. So they have a number of principles about scoping, about cost benefit, you know, about how to take action on it, and how to leverage existing information. I just put that in chat, and I would urge you all to look at that and sort of help your organizations interpret the utility of this legislation and the effectiveness of the legislation. I for one, have not yet seen it in its latest form.
All right, and then Greg Garneau, you got the end of it. Everybody's going to think about you.
You can
Great.
think about me. That's great. So think about beer, brats, and cheese curds, and that's Wisconsin for you. So I think, bad guys exist, and bad guys are going to try and do things to healthcare organizations because there's profit motive there. And it's a really important thing for everybody to be involved in the fight. So I appreciate the opportunity to speak with you all today. And, happy to answer any questions. If anybody ever wants to send me an email, I'll be happy to answer a question.
Absolutely. Yeah, I will. I'll send another email after this to everyone. And if you have any questions that suddenly just popped into your brain, feel free to email me and I can also get them those questions. But it looks like it is 4 o'clock now. So I'm going to end this meeting, say goodbye. Thank you to our speakers. I really appreciated this conversation, and thank you to our members who attended today. As a reminder, these monthly policy briefings are monthly. So we will have one at the end of March. And so you can be on the lookout for that.
Thank you to EHI. Appreciate it being
Thank you, everyone.
Yeah, thank you.
Thank
Great
you.
day.